Our next presentation is from Ms. Jaimie Vickery. She will be talking about expanding access to adult immunizations in Missouri and beyond. Jaimie Vickery joined the Vaccinate Your Family as a manager of state and federal vaccine policy in May 2021, leading the cultivating and maintaining relationships with U.S. government officials, members of Congress, and relevant committee staff to create opportunities to develop and support sound public health policies that affect immunizations across the lifespan. Jaimie coordinates with local and state public health and immunization partners to support vaccine policies and legislative efforts throughout the nation, including educational programs to support advocacy building at the grassroots level. Jaimie comes to the role with a wealth of experience in public health, advocacy, and maternal and child health. Most recently, she was a member of the senior leadership team at Cure SMA, a patient advocacy group for rare neurological genetic disease. While there, she led both federal and state advocacy efforts to increase screening for the condition, improve access to care, and to develop treatments. She also led the federal advocacy and government relations for the March of Dimes Foundation, where she developed and executed several successful advocacy campaigns, resulting in increased funding for health research, greater inclusion of women in clinical trials, and improved immunization efforts for pregnant women and infants. She also managed the Zika Coalition, a diverse group of over 100 organizations with successfully advocated for public education efforts about the virus, mosquito eradication efforts, and epidemiological research to prevent and spread the virus. As a native of Southern California, Jaimie holds a BA in Political Science from Missouri Pacific University and a Master of Public Policy from Georgetown University. Welcome, Jaimie.
Hello, good morning, everyone. I realized I am the last speaker before lunch, which is almost as bad as being the worst speaker or the last speaker before happy hour. So thank you again for having me. I'm just sort of laughing to myself, thinking of working on Zika, and we thought that was going to be the virus that was the big one. And oh, my sweet summer child, how naive you were. The last 3 years really have underscored how important vaccines are in really just preserving our way of life. There is not a single aspect of our life that has not been impacted for the past 3 years. Those of us in public health, more than anything. I think the past 3 years have been, let's just say we've all aged about 15 years in the past 3 years. Particularly those of you on the front lines who are in the clinics, treating patients, giving the vaccines, dealing with some of the, let's say, resistance that you may face, the hostility and all of that. So all of you who are the boots on the ground, thank you, God bless you, and thank you, because I sit in an office and talk to officials all day. It's really good to be here among you and realize and see why I do what I do. So thank you for that. So today we're going to talk about increasing access to vaccines here in Missouri and beyond. We talked earlier, the earlier speakers, about getting people to want to get their vaccine, getting people around some of the questions they may have. And we always say at Vaccinate Your Family, it's okay to have questions. You should ask questions. You should be an informed consumer of healthcare. You should think about what you put in your body, says somebody who had 3 cups of coffee and candy for breakfast this morning. But certainly asking questions is normal. Don't ever feel ashamed for doing that. But make sure you ask those questions of your doctor, your nurse. Don't ask them on your Facebook next door group. Don't ask them on Instagram. Don't ask them on TikTok. Ask them from a medical professional. So once you've gotten somebody to that point where they want the vaccine, how do you ensure that they can get it? One of our founding principles is ensuring that everybody who wants a vaccine is able to get one, regardless of their insurance status, regardless if they live in inner city St. Louis or a more rural small town in Missouri, regardless if they live in Hawaii, regardless if they live in Maine. Everybody should have access to vaccines. It is more than just taking care of that person, it's taking care of our communities as a whole. So Those of you who don't know Vaccinate Your Family, we were founded about 30 years ago, and our co-founders were former First Lady Rosalind Carter and former First Lady of Arkansas, Betty Bumpers, and Mrs. Bumpers' husband, the senator, because let's be honest, she was the powerhouse in that relationship. Were really just instrumental when Mrs. Carter was First Lady of Georgia. Those two met, and back then it was a wives' retreat because there were not female governors yet, and hit it off. And Mrs. Bumpers she was a rural school teacher and actually lost students to rubella and thought, oh my goodness, there's no way that we should be losing people to something that can be so easily prevented. And so those two put their heads together. They were really instrumental in creating the Vaccines for Children program. And out of that work, Vaccinate Your Family was born. Back then, we were known as Every Child by Two, really focusing on childhood immunizations. As the years went by, we realized that people were kind of forgetting the importance of vaccination across the lifespan. We think of getting babies vaccinated. We think of making sure older people, making sure your mom or your grandparents are vaccinated. We kind of forget about that gap between 11 or 12, and then once you're up in your 60s and retired, but those are just as important. So realizing that, we changed the name of the organization to better reflect the need for vaccines across the lifespan. So here's some really good news. There was a very big piece of legislation that passed last year. It's called the Inflation Reduction Act. Catchy title. It had about 197 million different things in there. It was a very, very long bill. One of those provisions that were in it was around Medicaid and Medicare access to vaccines. So as of the first of this year, Medicare, now if you have a Part D Medicare plan, that's the plan that is your drug plan, all vaccines are free. Prior to that, depending on what plan you had, seniors or people with Medicare could be charged a copay for shingles vaccine or a pneumococcal vaccine. Obviously, if you're retired, you may be on a fixed income. Things could be pretty tight. And a copay could be enough to turn somebody off from getting that vaccine. And particularly with this population, we know that older people over 65, are more prone to vaccine-preventable diseases. I don't want to say they're vulnerable, because if my mother heard me say that she was vulnerable to anything, she would get on the next flight and come out here and give me a talking to. Then she would get all her book club ladies, and they all would come out and give me a talking to. No matter how old you are, your mother can still do that to you. And the really, really great thing, the thing that we are just over the moon excited about, is the Medicaid provisions. So as of now, not all state Medicaid programs cover all routinely recommended vaccines for adults. There's 14 of them. Each state, most states cover most of them. There are a few exceptions to that. So now not only do all state Medicaid programs have to cover all really recommended vaccines for adults, they have to do it with no copay, which is huge. If you look at least in DC, where I'm from, getting a flu shot without insurance at CVS at Minute Clinic can be $95. That's groceries. That's gas in your car so you can get to work. That's new shoes that your kids need. And when you have all these other things impacting your budget, especially now when things are just more expensive than ever, you just don't get it. You're not going to spend that money if you don't absolutely need to. So we're very excited about that. Missouri does cover all of these vaccines, so it's a pretty easy implementation on that as well. There's some other states we're keeping an eye on. You can probably guess which ones they are. Not great on vaccine policy in some places, but we're certainly very, very excited about this and working to make sure it actually happens in some places. So right now, insurance is covered by 4 programs. Private insurance, that is your Aetnas, your Blue Cross Blue Shield, Cigna, probably what most of us have. Under the Affordable Care Act, they do have to cover all routinely recommended vaccines for anybody on their plan, babies, teenagers, adults, seniors, etc. Medicare and Medicaid, like we just talked about, will now cover those. There's the Vaccines for Children program, which I'm sure most of you are familiar with. We'll go into more detail about that. And then Section 317. What is VFC? As most of you know, I imagine most of you work in VFC. It's a federal funded program. So it's actually at the Centers for Medicaid and Medicare Services. It's kind of an unusual model. Then they pass money on to CDC, the Centers for Disease Control and Prevention, that buy vaccines at a discounted rate from the manufacturers, from your AstraZeneca, from Moderna, from whatever, who makes these vaccines. And then they distribute them to providers who give them to eligible children. So who is eligible for VFC? So it's anybody who's under 19. It does stop at 19. And then these are American Indian, Alaskan Native, Hawaiian Native, someone whose family is eligible for Medicaid. So Medicaid already covered vaccines for kids. It was when you hit 19 that you were on your own in some places. Underinsured is kind of a funny one. There were some plans that were grandfathered under the ACA that don't have to cover all vaccines. Those are kind of the healthcare ministry plans that you'll see sometimes, Farm Bureau plans, and then the short-term plans that are really designed if you switch jobs and you don't have insurance for 2 months until your new coverage kicks in. That's what those are designed for. However, kids who are underinsured have to receive these vaccines at a federally qualified health center or a rural health clinic. You can't just go down to Walmart and get them. These kids have to be, their parents, to be honest, their parents have to take them to one of these centers to get that. That's obviously an issue, something we're working on as well. And then, of course, kids whose families don't have insurance can get vaccines for free through VFC. It really is free. Providers can ask for an administrative fee. And then, of course, if you take your kid in under VFC because they have an ear infection to get that looked at, and then while you're there, the doctor says, let's get them their flu shot, they can charge for the other services, but if it is just a vaccine appointment, they can charge an administrative fee. Now, they can waive that if the family can't swing that fee. Part of the problem here is people don't always know that that fee can be waived, and then having to ask your provider to do that, it's embarrassing. People don't want to admit that, and so a lot of times they just don't do that. They don't ask, and then they don't come back if they can't waive that fee. So that's something we are working on as well, to be able to have that waived as well, because it is confusing, saying your kid can get this for free, and then you come in and it's a $25 administration fee or whatever it is. And if you have 2 kids, that's $50. That's not an insignificant amount of money. So VFC is open to every child, regardless of their immigration status. We want to make sure, given the nature of infectious diseases, every child is protected. Kids play together. Kids are gross, let's be honest. You go to school and there's, nobody washes their hands. They're climbing all over each other, and they're sneezing and they're coughing all over each other. So let's make sure that every kid is protected. So Section 317, and it is a section of the Public Health Service Act. It is not terribly creatively named. Some of the policy people are not the most creative folks in the room. We let our marketing and communications people do that. But it's called Section 317 program. You'll hear 317 thrown around a lot. And so this provides grants to state and local health departments. And then those departments can turn around and use those for any number of immunization-related activities. So what are some of these activities? So one is administering VFC. Like I said before, they don't have to buy those vaccines with 317 funds, but they can help administer the program. There's a couple of different things you can do. You can keep your vaccine clinic open later. We've heard stories of people who are saying, "Oh, we got more 317 funds this year. We could keep our clinic open until 6 instead of closing it at 5. People get off work at 5. People don't have to leave work early to get over here." Monitoring, storage, and handling, always a big issue, always complicated, always takes more money than you think it would. And then the outreach and awareness campaigns. This is a pretty cool feature of 317 because the people on the ground in the local, state and local health departments are the ones running those campaigns, and they can tailor them to better reflect their community. Where I live in Washington, D.C., a public outreach campaign is going to look very different. You're going to put ads on buses, you're going to put ads on the subway where public transit is a thing and people actually take it, versus in a rural small town where you're going to have billboards and flyers up somewhere. A public awareness campaign is going to look really different in LA than it's going to look in Springfield, Illinois. So it's really, and you can reflect that given just different ethnic makeups or different socioeconomic makeup of the communities that you work in. And then the last one here is purchasing and administering vaccines for uninsured adults. So this is really interesting, and we'll get more into this later as we go along. So right now, COVID shots are covered by the federal government. That will be changing. So we're working through some of these things of how this is going to happen. But as of now, if you don't have insurance and you need a flu shot, you need a shingles shot. Through the county health department or state health department or the local folks on the ground, you can go and get your flu shot through that and provide that to people without any insurance at no cost. As you can imagine, 317 funds are never enough, but particularly in the providing vaccines to uninsured adults. So based on that, there's something called the Vaccines for Adults, or VFA program, this idea has been floating around. The president proposed it in his budget this year and the last year. Not to go too deep into the details of the federal budget process because it is boring and it is complicated and it is ugly. And as someone who does this for a living, it is complicated and boring and ugly, and I will never completely understand all of the nuances of it. There are lawyers in DC who make really prosperous career-long careers of just the very intricate details of this. But the president proposes, it's to kick off the federal budget season every year. The president puts out his budget request, and it has all of the different agencies in it. I'm old enough that I remember getting it in a actual paper form, and it looked like a phone book. Now it's all online. And it is a president's wish list that goes to Congress and says, we need this amount of money for this, we need this amount of money for this. The Vaccines for Adults idea was in that document the past 2 years. So essentially, it's VFC for adults is the best way to think about it. And so it just takes that really successful VFC model and expands eligibility to people who are over age 19. Right now it is folks without insurance, Native Americans, and Hawaiians, and Alaskans, and then underinsured as well. It doesn't cover Medicaid now because, of course, if you have Medicaid, your vaccines are now covered. So this is not likely to happen anytime soon. The president's budget request is DOA once it reaches Congress, given the political makeup of Congress right now. It is a rebuilding year for those of us working on this program. We are working on I don't know if the bill will actually even be introduced, but we're working on it, what this program would look like, what kind of funding do we need, what sort of systems do we need in place, and also working a lot on education. Why is it so important that these people have vaccines? Who are the uninsured? They're not always who you think they would be. They don't always, sometimes people without insurance look like me and you. You don't know someone's circumstances, and so it is critically important, just given the nature of infectious diseases, of course. So there are challenges to increasing access, not surprisingly, and so we'll go into some of these now. So the first, again, preaching to the choir here, we are always dealing with the unexpected. And as much money as we get in 317 funds, and I shouldn't even say that because it's not a heck of a lot of money, there's always something that comes up, no matter what. So obviously, COVID just really sapped public health resources. Things were held together it feels like they were held together with bubblegum and chicken wire. And I don't know how public health people do it, and I don't know how you're doing it after COVID. And you can see the numbers here. This is the increase in funding, the 615, 613, and then 650. You can see those increases in Section 317 funding, even though it was a bit of an increase, just not nearly enough to combat all of the challenges that public health departments are facing. And last summer was particularly interesting. We had dual public health emergencies with Mpox and measles outbreak in Minnesota, and then a case of polio in New York, and then the ongoing COVID, and then the need to get everybody caught up on all the routine vaccinations as kids were going back to school, people were going back into their offices, kids were going back into daycare after being at home for 2 years. And this was true even before COVID. San Diego County, my hometown, spent nearly $13 million combating a Hep A outbreak. That's a heck of a lot of money. And the appropriation for Section 317 funds, for the entire country was less than half of that. So you can see we just need more money through Section 317, always did. We're really grateful that people seem to be getting this idea, and the Congress has increased funding for that. I don't want to come across as ungrateful and say, thank you, but thank you, but. So this is kind of a great graph that our comms person put together for me, and you can really see here the challenges that we face in terms of funding, and then how much we spend. And this is just for diseases among adults. These are all things we have vaccines for. If people could get these vaccines, if we had the funding and the infrastructure to be able to reach these people and get them vaccinated, you can see the cost savings, let alone just doing the right thing and preventing suffering and death is tremendous. So here's when I was talking about buying adult vaccines for uninsured folks under 317 funds. Here's where it gets interesting. Right now we're in something called the public health emergency. It's been around for about the past 3 years. And under that public health emergency, the federal government buys COVID vaccines from the manufacturers and boosters and provides them to everybody, regardless of insurance status. So if you got a COVID vaccine, I'm assuming everyone here did. I'm assuming everyone here is boosted and all of that. The government picked up the tab for that. The public health emergency ends May 11th, which is in 2 weeks. How is it already May? And that means that your insurer will have to cover that cost. Medicaid, Medicare will have to cover that cost. It's fine. It's taken care of. We're not real worried about people who have insurance. The problem is uninsured people. As of May 12th, the federal government will no longer pick up the tab for that. That means these funds have to come out of Section 317. 317 funds are already pretty strapped. Now, will it be like a switch as of May 12th? Oops, sorry, can't get it? No. We have enough supply. There's been enough pre-ordered that HHS and the Secretary expect that there'll be enough supply of vaccines for 317 for people without insurance to get them until late summer, early fall. We're a little bit concerned because that is flu season, COVID booster season. But right now, if you know somebody who does not have insurance and they need a COVID shot, I would get them in ASAP, get them down to the Walgreens pharmacy or wherever they want to go to get that taken care of. If they have to get it on May 13th, 14th, they'll be okay. I would just really encourage people to do that sooner rather than later. So there is a White House plan. They announced it last week. There are not a lot of details to this. This plan is brand new, and if it feels like everything is brand new and we're flying by the seat of our pants a little bit, welcome to the past 3 years. There's really, and in all fairness, we've never done this before. There's no model to follow here. So the White House introduced something called the Bridge Access Program. And so that's going to use 317 funds to continue to make vaccines available to uninsured folks. They're saying through next summer. We don't have a ton of details on this. And then working with pharmacies to make sure that they can keep giving COVID vaccines through December of next year. Of course, when you think about someone who's uninsured, you're most likely to access healthcare through the pharmacy, through the Walmart down the street, at CVS, at Walgreens. You're not going to go to the doctor's office if you don't have insurance. Go through all of that. A lot of these folks don't have a ton of experience with the medical system, don't always trust doctors. So being able to do it in a pharmacy, particularly in places that don't have a lot of medical facilities. There's a Walmart in almost every town. There's a pharmacy. Being able to, you're already at Walmart on Saturday morning getting groceries and whatever else you need. So really keeping this available to people who need it the most. There's also, so the manufacturers have talked about patient assistance programs to ensure people who can't afford a vaccine can be able to get one. We haven't seen a lot of details on those as well. So this is something we're continuing to monitor. It's going to be complicated. It's going to be kind of weird. What hasn't been weird in the past 3 years? And so certainly we're excited that the White House and the administration has realized the issue. We're continuing to work to make sure that this is not a cliff that nobody gets pushed out and people can still get their COVID vaccine. You did all the work to convince somebody to get it. The last thing we need is for them not to be able to afford it. So we need your help. This is a group effort here. One of the most impactful things you can do is email your members of Congress and your senators. I am a former Capitol Hill staffer. I completely understood that I did not do this for a living. I did not know all the ins and outs of this. As somebody who worked on Capitol Hill, I did healthcare policy, I did education policy, I did women's policy, I did, agriculture. I did 7 different issues. There was no way I knew all the ins and outs of this. So I really relied on people in the district who knew the ins and outs of it and knew how it was going to impact what they did in that community. Your voice is invaluable. So one of the things that we do, and we have this on our website, the address is right there. If you don't get it down, our website is Vaccinate Your Family. If you go on the, super easy, you can go on where it says Take Action, and it'll bring this up for you. There's a whole system there if you want to email your members of Congress and your senators. You click on it, you put your address in. There's text already there for you to send. I know sometimes you sit down and you think, oh my gosh, what do I say? It's already there for you. If you want to personalize it, you're welcome to. It's super easy. You can do it waiting to pick your kids up from school or soccer. You can do it standing in line at Target. It takes about 5 minutes tops to do that, and that's really, really important. The anti-vaxxers are not numerous, but they are loud. Oh my goodness, they are loud. And I've heard stories of people saying, we get tons and tons and tons of emails and phone calls from the anti-vax crowd. We need to hear from people who support vaccines. We know you do, so speak up. So you can sign up for that. Also, too, you can put your email address in there. We'll send you an email when something is coming along, and you can link directly to that to email your members of Congress. The other thing there is something called the State of the Union Report, or SOTI. We call it SOTI, and that we time it around the President's State of the Union address to Congress every year. And that lists out our wish list for Congress. It's all of the changes in federal policy that need to happen to make vaccines more accessible for all of us. You can view it there. I have 2 copies left. If you want a physical copy, I'm happy to share those with you. We need to do another run from the printer. Last year we printed out 100 of them thinking we were going to go back to in-person meetings, and we didn't. So I had to put a bunch of them in the recycling bin. Also, 2 of the other things we do is there's something called the Vaccination Collaborative. That is a bunch of groups all over the country, from health departments to community groups to all sorts of folks who are doing the work on the ground, getting people vaccinated, running the clinics, running the outreach campaigns. It's a call once a month. It's pretty much sharing resources. What works in your part of the state might work in another place. So it's a great way for people to get together. There is a policy element to that. The other thing we do is a policy call. That does get kind of wonky and very specific policy. You are welcome to join either one, both, neither, whatever, but just wanted to put that up there for a resource for you all as well. And that's my email there. My name is spelled sort of weird. It's Jaimie, so I put that up there for you all. And so we really encourage you guys to get involved on the federal level. I know sometimes it can be really intimidating. I know sometimes it's scary, but it's so critically important now more than ever. And we are here. We've got the resources. We will walk you through this. We will help you get everything you need to do advocacy.